Okay. Hello, everyone. My name is Nick Larson. I'm with the Positive Behavior Support Program at the WVU Center for Excellence in Disabilities. My title there is Lead Clinical Educator. And I'm going to come to you with a humble heart with today's presentation on Positive Parenting Program, or more, as it's more traditionally known, Triple P, in the sense that I'm kind of here by default. Myself and a CED Parent Network Specialist, Tina Crook, we're kind of the people at the center right now who present Triple P content, or in my case, can provide it to families directly. And this is something I would love to see grow. It's my understanding there's been, recent conversations in the state about how we might be able to bring this to more places. And so I'll be honest about some of my kind of experiences and at times barriers with being able to do it more widely, and hope that perhaps people will have some thoughts. My presentation is relatively short today, but will hopefully give you a sense of what the experience is like going through this as a family member, some of the skills that it builds, who it might be a good fit for. And then if you all have any ideas of how we might be able to do some targeted outreach and balance that with our present limited capacity. But I know a lot of my teammates who are cheering me on today have expressed interest in doing some of this as well. And it's definitely permeated a lot of our different things that I know I do in positive behavior support. So some things will probably sound familiar to them. Um, but happy to talk a little bit about this today. And along with many of our trainings, this is made possible by our support from the West Virginia Bureau for Behavioral Health. And we thank them for that. So I definitely will invite any questions you have about this. And again, kind of come from a framework of my experiences with my particular version of Triple P that I've been certified in and practicing. So just brief background, and we've done a few, kind of outreach and basic information sessions on Triple P. But it's an international evidence-based package of parenting strategies, largely kind of going back to the ostrich in South Africa, developed on other continents and, then eventually brought to America. And at its core, it builds on a lot of things I'm sure we're familiar with a variety of our service models. We see a lot of overlap in things like parent-child interaction therapy, some of the elements of positive behavior support. But some of the unique features about it is really being kind of tailored in its delivery to parent learning needs, really trying to put them in the driver's seat of decision making and collaboration with us, and really encouraging ongoing reflection of how parents are doing with the various skills that are addressed, as well as being able to give themselves adequate credit for when they see behavior change in the course of their work with us. So there's some key aspects of Triple P, regardless of the way in which it's delivered, and I'll talk briefly about that. There are several levels to it that can be very brief, that can be very self-directed, that can be very just media-based in terms of watching stuff, or it can be very intense in terms of watching or working with it alongside a dedicated practitioner. But these key kind of practices are at its core. So first among these, and thinking about, a hierarchy of needs, is having a safe, interesting environment, right? So being able to have a physical environment where children are basically safe to be able to play, to explore, and where parents are able to kind of go off and attend to some of the other tasks without having their eyes on them every minute of every day. So a lot of times basic safety proofing of an environment might be part of initial consultation if that's not something a parent has gotten the chance to explore yet. And in my limited number of cases that I've worked on with Triple P, I've definitely seen a wide variety of this. There have been some parents who have already implemented many interventions to accommodate for the needs of their children. There are others, though, who have not gotten that type of guidance. So starting there is really important. As it is in a number of my colleagues' cases, before we can focus on, more in-depth learning and behavioral support strategies, we really need to make sure that the environment is set up for success and for safety. Then once we've accomplished that, making sure that there's a positive learning environment. And this can be generally through a combination of kind of activities that are in place, as well as just the approach of adults in terms of utilizing learning opportunities to model and encourage learning from their children. So just being able to really promote learning, promoting new skills. And when you're doing this with the parents of children with a disability, there's often that kind of question about, well, what is it that, is appropriate to task them with? And that's another key practice that we'll get to shortly. Uh, part of that journey is learning appropriate assertive discipline, right? And avoiding things that are aversive. This might be something, for instance, that we are providing to a parent who has maybe been working on reunification with their child, right? So being able to make sure that disciplinary practices are clearly defined, they're delivered dispassionately, and that they're quickly over, right? And then being able to lead to then, again, the use of skills, using guided discussion, and really just being able to use it to address the behavior in the moment and being able to move on. Something that's unique with the type of triple P that I practice, which is referred to as standard stepping stones, it incorporates a couple of additional features in its content as opposed to one that could be delivered to theoretically any child the age of 12 or under who is having some type of behavioral issue. But there's a couple of specialized modules, and one is about adapting to having a child with a disability, right? This can be a journey for parents oftentimes that can involve some form of grief, really maybe readjusting what they envision for, their lives and for their children's lives. And of course, everyone's journey for that is different. Some of my colleagues know, and they actually got to meet my brother, who is born with autism, and he signed a media release, so that's why I even feel comfortable mentioning him on this. But my parents talked about how they had friends who had children about my age, and they had one child who had a very significant genetic condition they were born with, something that subsequently required round-the-clock care. And they were told that the odds of having another child with this condition were 1 in a million. So they had another child, and sure enough, had another child with exactly that condition. So, but they talked about how they would speak with my parents and vice versa about how they couldn't imagine, say, being in the position of a parent of a child with autism and those unique needs. And my parents couldn't imagine being in the shoes of a parent with such profound medical needs with their child. So again, the different challenges and, the different points of kind of acceptance and adaptation and building upon someone's strengths are going to be drastically different for every parent and every combination of parent and child. Along with that is being able to have realistic expectations. And one of the dances of doing triple P with families is to make sure that they're not leaning too far in the direction of being too strict or overly demanding with their expectations, but also not too lax with that as well. And that's actually more been the case in my work with families, is that they'll oftentimes be questions of, are they going to understand this? Will they ever be able to learn this concept? And it's humbling to be able to, bring to bear there again in an appropriate way once you've built rapport and trust. Uh, a strong body of literature that has shown that even individuals who are considered to have some of the most profound levels of disability have still been able to show the ability to learn and to communicate on some level. It's just going to require a lot of work to figure out, what that communication is and what is going to work best for them. So, but it's important, regardless of, what diagnosis or disability a child might have, that they still learn rules, learn expectations, and learn how to get along with others and to function best in their environment. Next part is being able to be part of a community. So, and a lot of times when we have encountered parents with this, they've become very withdrawn from their community because they've perhaps become very frustrated with dealing with behavioral issues. They themselves are maybe not feeling competent or confident to deal with things when they are out there. They may have been so consumed with caring for their child that a lot of relationships, and we can certainly see this a lot of times with marriages or other romantic partnerships, and just relationships with others outside the home. A lot of times that can suffer on the adult level as well. But it's really vital that in terms of social support for parents and just their own self-care, but also that child's development, that they have opportunities to be with their peers, that they have opportunities both within school settings, in community settings, to really be a valued part of their community. So that's a big part of the kind of latter sessions in Triple P, is really trying to develop that competence and that confidence to go out, to take risks, so to speak, and to have a plan for success in community settings. And then the last of our key practices for Triple P is being able to take care of oneself as a parent. Again, something that's in danger of being a platitude, but that's a big part of our work right from the get-go is stressing to that parent, the importance of their own well-being, and because otherwise they won't have that ability to, say, set a good example, to be able to stay calm, help their child co-regulate, and eventually learn those skills vital for self-regulation, if they are suffering and not getting the help they need. So you'll see that built into some of the very basic initial questions and assessments that are delivered. There's always something that kind of gets at the needs of the child and their behavior, the family's kind of functioning as a whole, parenting practices, if multiple people are responsible for that in the household, and then some indication of the parents' mental health and well-being. So I'll go over the ones that we utilize. But this is just very brief here, just touching upon some of the aspects of development. Triple P started in Australia with the work of Dr. Matt Sanders and his colleagues, largely at the University of Queensland. So it's kind of grown out from there. And it's been looked at in many studies over about the last 35-year period. Some of the more recent meta-analyses that were done in like 2012, 2013-ish, did question that, a lot of the studies that were there sometimes had, questionable rigor in terms of, again, the structure of the study as part of Triple P's nature is being flexible. Dr. Sanders and colleagues came back with their own meta-analysis in 2014, trying to highlight its effects. But when we've looked at them in comparison with other, well-established treatments like parent-child interaction therapy, for instance, we'll see that they compare, not identically, but they'll fare well in terms of reported effects on child behavior. But you might have in the study I just pulled on this slide that PCIT outcomes in that particular study, when they looked at the effects there, that they were large effect sizes, whereas for Triple P, it varied from large to more moderate levels. For instance, in certain studies where teachers were reporting on changes of child behavior, they weren't reporting quite the gains that parents were in home and community settings. In another study, mothers reported large positive effect sizes for child behavior, while fathers who were included in that study reported only moderate effects. That gets to a point we'll get to in a little bit later. So, and that's looking at the most intensive form of Triple P that works very, again, intensively in direct consultation with parents. There are what are considered less intensive forms of that. One of that is the group format. And so that allows parents over the course of generally about 5 sessions that are 2+ hours in length to learn this content, practice it alongside other parents. And so the study I mentioned here comes out of Portugal with a group of single mothers. And so they found pretty promising results there. They followed them up for periods of time. And when they looked at, improvements of child behavior, there was an immediate improvement right in that first, follow-up, and then kind of a leveling off. But compared to care as usual, you just had kind of a very, flat curve. So no real improvement there. Also, the group format seemed to be very helpful to these parents in terms of their reported social support, because that also immediately increased since it's sustained over the course of follow-up. Now, if we look more locally here at the evidence-based clearinghouse that the Bureau for Behavioral Health has up, you'll see that Triple P is listed under the supported treatment. And that's for that most intensive form of consultation. That's compared to well-supported treatments that include things like applied behavior analysis and parent-child interaction therapy. And in terms of other parenting programs, some things like the Incredible Years, those are in the well-supported category. So that also might be a barrier to wider adoption at this point, but hopefully something we can continue to develop and build. So what do Triple P strategies actually look like? So this pyramid kind of lays out the kind of foundational skills as well as the things that are more specialized. But this roughly follows from bottom to top how the parent sessions will go and evolve as they're working with a Triple P practitioner, right? So right at the base of this, just like, I was hoping to build with my dream pet that we mentioned earlier, uh, being able to look at things like building that relationship quality. So looking at opportunities to build upon quality time with their child, looking at regular opportunities for communicating with them and showing affection, right? Again, some parents may have this down as a very solid skill already, but others may struggle, especially if they've been dealing with, very intense and ongoing behavioral issues. And then it builds up towards more teaching-based strategies, things like activity schedules, giving that, again, sense of predictability and signaling what's to come that can be very helpful for children with autism diagnoses and other disabilities, and which, of course, can be helpful to all kids. Also, developing an array of interesting activities. A lot of the strategies for dealing with misbehavior that come later rely on diverting to other forms of activities. So parents go through kind of brief forms of reinforcement inventories where they identify things that their child likes and try to expand that out, as well as, tangible items or edible foods. So really trying to build up those forms of social reinforcement as well. Again, things that will be very familiar to the PCIT folks here is really building that importance of descriptive labeled praise, as it were, for when a child does engage in an appropriate behavior. And then going over basics of several different types of teaching strategies, right? So being able to do things like teach backwards, so if a child's learning to put a coat on, maybe starting with the very last step of putting up the zipper the rest of the way, and then being able to work backwards in time to steps that are further and further out from the end of the task. Also being able to do things like ask, say, and do, where maybe a parent starts with the least intrusive form of prompting of like asking a question of like, oh, do we see something green? Okay, the book is green. Say the book is green, so just working with that, depending on where their child is at with that skill. Also being able to use incidental teaching. This is kind of coming upon little moments, things in the environment that might be question opportunities for learning, being able to expose the child to more verbal language or more communication, and also being able to use more physical forms of prompting. So definitely important as children are learning a skill that they have the motions of it down. So physical guidance, especially with young kids, might be a really critical part of getting them through the motions of, an appropriate response to a situation. Parents are can be given the chance to show little video vignettes with this, and Triple P has been really great with creating, video examples that are not only illustrative, but they're also entertaining. They're done with some humor as well. So I usually have a chance to show this to the families as we're going through this content in a workbook or through part of my session task list for meeting with them. But one of the things they really relate to is when you see the video example of stressing the importance of setting a good example, and how a common cause of misbehavior can be a child can pick up something like a parent, pounding their fist in frustration, and it cuts to the child like doing the same thing once their parent has left. A lot of parents will be like, oh, yeah, yeah. And the other thing they really relate to is the escalation trap that can happen, right? Where, a parent asks a child to do something, the child says no, the parent increases their tone, the child increases their tone, and, it just escalates for both parties until somebody gives in. Oftentimes that's the parent with, whatever thing that they were asking or ceasing the demand. They'll oftentimes see how they themselves have been getting dysregulated in the course of that and how their child has been picking up from that. The videos are a nice way to do that, as I said, with humor, and also, making it normalized that a lot of parents deal with that. So that's been very helpful for me in individual consultation. And then also developing a few key skills that children are going to develop. So parents then develop behavior charts and really try to promote that positive skill. And then we progress kind of like in PCIT, where you get child-directed interaction and building the relationship quality down. And then you go to the parent-directed part that deals with disciplinary components. Later Triple P sessions focus on those assertive discipline practices. So being able to set clear ground rules, being able to have directed discussion appropriate to their child's communication and developmental level, and then having a variety of strategies they can use when they maybe start to see behavioral issues arise. A lot of times intervening early can mean diverting to a new activity. That's why having a variety of activities is so important. Being able to teach children to communicate. This gives them the basics of learning, functions of behavior, why their child might be doing certain things and using the behavior that they do, and what are some things that they can be encouraged to do instead. Again, if a child isn't communicating verbally, how can they do that with basic sign language or some type of other gesture or vocalization, perhaps? Um, Certain behaviors can be minimally attended to by parents. So that's where planned ignoring kind of comes in. If something is, say, like an annoying behavior or something that can be safely ignored, so to speak, I think, ignoring is a misnomer because, you're always having some level of engagement and monitoring here. But being able to utilize that when appropriate. And when behavior does start to become more significant, if a child is, say, starting to become aggressive, utilizing approaches like brief interruption, which is, a momentary, about 10-second, just like physical guidance of a child to hopefully help them settle, and then removing that, and then giving them a chance to, a lot of times that will help them to reset. Other times, certain behaviors like physical aggression or self-injury might be very serious, and some type of blocking of the response might be something that's called for. And then finally, it utilizes very basic elements of a disciplinary procedure of quiet time. Again, this is some type of non-exclusionary timeout. It can be something like a carpet square or a chair that's in the general environment, just some spot that's designated for a child to go to at the parents' prompting. Again, we want to hopefully help children to recognize the need to do that themselves and self-initiate. But in this case, the parent kind of selects a spot that will work for them with that. No, we oftentimes work with parents who have, maybe age or other physical disability limitations and issues. So it might be a case of, rather than moving the child to a setting, being able to, say, time out a item or activity, doing like something like a swoop and go or something like that. And then in certain cases, again, with kind of close discussion with their practitioner, if they use a backup of timeout of something like going to their room for a brief period. So, but they don't have the benefit of that intensive coaching that comes with something like PCIT, where you're leading someone through all those steps. So those are relatively minimally stressed when we go through triple P sessions. For practitioners, there's a few kind of guiding principles. One of these is that we really want to empower the families and children that we serve. So that means making sure that they have a large stake and a large voice in the goals that are being worked on. Building on existing strengths. I know this is going to sound very familiar to my PBS colleagues, but also trying to facilitate access, recognizing that a lot of families have schedules that might fall outside of regular clinical hours. So really trying to make ourselves available when it works best for the families. We thankfully have a lot of support in our program to have flexible flex time work schedules where we do meet with some families at unconventional times. I've had support to meet with families in clinic after hours in the past as well. So being able to just meet them where they are when they are. Also being able to time interventions to optimize impact. So that's about kind of recognizing that something is maybe in a growing stage before it gets to a crisis stage. That's why the various assessments that we use in triple P are really important. Say if we are seeing signs that a couple are having major issues, right? Maybe with their parenting practices or with their relationship, that's something where, we may try to direct them to some form of counseling, early on, as opposed to when it's become a really major issue. And it may be a major issue by the time we get there, but really trying to be timely with our interventions. Also trying to work in when something socially significant is happening. One family I'm working with right now, the big problem situation that I can tell is going to be like the kind of big thing we plan for is coming off of like a playground or some type of, really pleasurable community setting. I think with the holidays, there's going to be lots of stuff for this parent and this child to go to. So I can tell you that we're going to be planning for something like that to go out and to try to address when they are developing their plan for a high risk situation. We also want to make sure that we're being mindful of some of those other needs that families might have, right? So, it's much with our trauma-informed work, right? When we're identifying that there's maybe been untreated trauma in that child or in that caregiver, maybe they're also nestled within adverse community environments. Again, we want to try to get them connected to appropriate supports. Being gender sensitive in the practitioner training really refers to trying to avoid, the focus of intervention being on things that might fall around, gender stereotype roles in terms of raising children. So, more simply said, engaging all the parents and all the caregivers in the importance of these practices, and not just focusing on one parent because they're with the child for the majority of the time, but that every parent's example has an ability to influence that child's behavior. Not only do we want to utilize evidence-based interventions in our own practice, but we also want to help families to trace, like, what's the mechanism changing this child's behavior, right? And making sure, as I said earlier, that they give themselves the appropriate credit for, when they've changed something about their parenting practices. Okay. Just trying to keep an eye on the chat if anyone's got any questions there. And then also ultimately also utilizing culturally appropriate interventions. And one of the things that's mentioned there is not only cultural awareness and competence, but also not falling into the trap of looking at a parenting practice that maybe goes against what's outlined in Triple P and just saying, well, that's something that's culturally based, and you just leave that there. You also want to kind of look at, okay, how's the parent viewing this practice in terms of their immediate situation, and how might they view it when other alternatives are represented to them? But we certainly want to be sensitive to the culture that's familiar to a family and to a child. All right, so some of the ways that we try to gauge this as we are initiating and updating our work with families in positive behavior support with our program, we have a variety of things that people fill out regardless. But for Triple P clients, they get some additional measures as well at the beginning and at the end of their sessions. So these are some ones that we selected when we first started doing Triple P. There's a lot of flexibility in the Triple P, provider resources provide a variety of options, but the ones that we will do for all individual clients will be that strengths and difficulties questionnaire, which is about various forms of child behavioral issues. There's also the parent and family adjustment scale. This looks at the degree of various types of parenting practices. Some could be considered good, some could be considered less good. Others may be more neutral, but they're rated on a degree of how often they do that. And then also the parental figure or figures are given some assessment about depression, anxiety, and stress symptoms. So these are all looked at. They're all then entered into Triple P's online database that can provide, clinical cutoff indicators. And you may provide additional measures as well. So if there are two or more caregivers who are responsible for a lot of childcare in the house, you could give an assessment on degree of parental disagreement. So the first case I ever had was actually by two sisters who were raising their nephew. And, they definitely at times had differences in parenting approaches. So we kind of looked at some of those assessments to focus in on what were areas of disagreement and, what consensus could they come to with each other. And a lot of these things are probably going to look familiar to most, if not all of us. But these were just some things that stuck out to me when I was in the course of my provider certification, and as I've revisit the practitioner materials, prior to the various session content. But there's a lot of emphasis and example scripting for practitioners that really stress that kind of letting parents like start out with that. What do you think about this? What do you think is going on? And then only after they've really exhausted kind of their own take on things, that's when we step in as professionals offering our guidance or our take with permission. Well, can I share kind of what I've kind of been noticing here? And again, really trying to get their consent to that as we share that information. So part of that is being able to really demonstrate reflective listening with frequent summarizations of the various kind of things that they've described. Last week, you were telling me about this, and that you were going to try to do this. How has that been working for you? Do I have it right? How I've been seeing and hearing about this? Again, frequently checking for completeness and clarification. I'd say the thing that really stands out to me the most about Triple P is the role play element. So as we get through things like those teaching strategies or those assertive discipline practices that I mentioned earlier, the manualization of triple P really stresses that through role play, right? So first you have a practitioner demonstrate that, and something that you are really supposed to do with that is model the self-reflection process, right? So you may demonstrate, giving a child an instruction to stop something, right? That they're doing, like they're being too aggressive with something. And what do you do when they do stop, right? Giving them a labeled praise for thank you for doing what I asked, right? So you may say something to the parent like, all right, well, let's see, two things I did well. Let's see, I think I responded pretty promptly and my tone was neutral. It was firm, but it wasn't aggressive. Let's see, something I would do differently would be I would maybe giving a more specific labeled praise or something like that. So you're demonstrating, even for you as the practitioner, there's things you feel like you could do better in the moment. And that type of reflection is really key as parents take this content in the back half of the sessions and really, practice it at home and then ultimately take it out to a community or high risk situation. And then, kind of as we're checking in and hopefully seeing improvements of behavior as we go along, just asking parents, well, why do you think that is? Why do you think that this situation went a lot more smoothly? And hopefully teeing them up where they can reflect and attribute it to some of their own changes in their parenting practices, as opposed to like, well, I don't know, maybe they're just growing out of it. That's a potential pitfall that the triple P curriculum goes over, is that sometimes we may just assume that, a child will grow out of a certain phase as opposed to being intentional with how we address behavioral issues. So we want to make sure that parents are not only seeing the impact they may have in having maybe inadvertently modeled forms of challenging behavior, but what are the things that they are doing as they're stepping up to help their child improve? Again, we really want to build them up throughout this process. So this is just a quick little excerpt that comes from the workbook that parents get when they do the standard stepping stones triple P. I love how they set this up in that they're small little chunks of information with clear, easy to follow goals and examples. And I don't think any of it is like too daunting generally for parents. The homework assignments are very clearly defined and achievable. But early on, this is in session one, as we're going through and doing our clinical interview, parents are asked to come up with goals for change in their child's behavior, as well as goals for themselves. And that's definitely something that I've taken even when I'm not doing a triple P case. I try to get a sense for that parent about, okay, what does success look like for your child in terms of what you're seeing from them? And what does success look like for you? And then maybe what's something that allows you to do as a family? Like what's part of your vision with that? What does a good outcome actually look like in terms of, doing some type of, event together, or again, something that brings you joy. And as it says here, we want to make sure that the goals they're coming up with are observable and measurable. So that's where we as practitioners or as behavior support people might help them with, say, operationally defining the thing they're going to be working on so they can keep accurate track of it. As I mentioned before, the videos that are available, and there's a form of triple P that's all video based for parents to watch. That might be important for accessibility issues or literacy, for instance. But those can be further ways to demonstrate some of these things or for them to be able to review. All right, this comes from our community presentation, but this is basically to show you that triple P can take a lot of different forms. And in general, the higher the level that's indicated, the more time is required in the delivery of that and the more direct participation a practitioner has in the process. The green boxes show the two forms that the WVU Center for Excellence in Disabilities currently provides. So there's the standard stepping stones triple P that I provide, and there's also seminars that our Family to Family and Pass for Parents program does about every 2 months. And I'll show you a link where you can find out about those and direct interested people to. But as you can see, there's a lot of other formats as well, some of which are very brief. The brief primary care triple P is, one, brief 15 to 30-minute session with a little bit of phone follow-up. There's triple P online, where, parents may get that workbook that I showed, but they're really left on their own to do it. A practitioner may be available on demand for them to call, but they're not a regular part of the process. And then there are at the bottom of this slide a lot of supplementary courses. So I was learning about some of these in prepping for this presentation. But from left to right, there's the lifestyle triple P. That's for parents who maybe are helping their trying to help their parents with weight loss or other physical health issues. There's the enhanced triple P. So this is where there's maybe some emerging issues of partner conflict or complicating mental health issues. There's also the family transitions triple P on the far right. That's when parents are actively going through separation or divorce and dealing with that unique kind of change in life circumstance. And then, as I mentioned earlier, triple P is often employed when there has been some past instance of abuse or neglect. And so a parent who maybe goes through those initial 10 sessions, they may benefit and they may need additional support beyond that. So there is what's called Pathways Triple P, and that really is specialized for parents who have anger management issues, might be at heightened risk for abuse again. So that's a chance for them to get some content that's really geared towards self-regulation, anger management, and being able to seek appropriate help. So, and this is the general structure of sessions. Again, this is designed for clinic use over a therapeutic hour. So I've found when I do these sessions on Zoom, we're definitely able to hit that in that time period when we do long distance travel. I may do some things that go beyond the 60-minute mark, like helping them connect maybe with other programs, as was kind of indicated on those earlier slides. But session one is that initial interview, and also parents complete those assessments that I mentioned earlier. And then between that, those assessments are scored, and they're part of that. Parent also in session one selects a data selection collection system. They figure out what behaviors they want to try to address and change for their children and themselves. And they also go through a few different options of ways that they can record that information. And then they set right to it, like right from the get-go. They're recording that data. And then that's part of what we do in the next session, where we share hopefully our own observations, but also those assessments they've filled out, and then anything that they've collected data on in the meanwhile. We then progress to those teaching strategies for helping children to develop, then going through those aspects of assertive discipline. Parents are then given a few practice sessions where they typically are going to do this either in home, or if they are seeing their practitioner in clinic, in a relatively controlled environment where there's fewer variables. And so that's where they engage in a lot of that self-reflection and feedback. And all right, great to have you, Dr. Swagger. And then we proceed to really addressing that high risk situation they identified. As I mentioned, for someone I'm working with, it's a playground situation. For others, it might be a grocery store visit or some other type of transition. And that's where they will go through in detail, kind of like a task analysis that you might do for some type of, goal behavior you're trying to teach somebody, or that parent may do for teaching their child. But it's a checklist for them of what they're going to do as they go through that high risk situation. Preparation for their child, going over expectations, again, making sure that they know what to do before then, making sure that they know how they'll respond if a problem starts to arise. And then a chance to go over with their practitioner how that practice, how that planned activity training went. And then, as we get to program close, we want to again re-administer those measures of child, parent, and family kind of behavior, or depression and anxiety, or whatever we're utilizing for that we've selected. We want to repeat that again. And I haven't gotten the chance to do this yet, but being able to like do that as kind of a graduation ceremony, because it was brought to my attention when I went through my training of this. For a lot of parents, this may be the first time they've done like any type of higher level learning. So being able to do it like a graduation ceremony. I was very inspired when I went through youth mental health first aid training recently, and they did quite a ceremony when we completed that training. But that can be part of that closure and really celebrating how far that parent and their child's progress has come. And there are various types of certifications, specializations here. My type that I do is a form of standard triple P with those additional disability components I mentioned. There's also a unique form of triple P teen. I'd love to get certified in that, but that's for 12 to 16-year-olds. There's also one designed for very young children, which is really much more parent focused in terms of adjusting for that. Some things you didn't see on the earlier slide is also having an indigenous version of Triple P that I assume was developed largely with Aborigines populations in its original nation of origin. And then also a Triple P follow-up that's geared towards children who maybe have really heightened anxiety levels. So the Fear Less Triple P. So again, I was just learning a little bit about those, and I'm definitely going to read up a little more on them. As I mentioned earlier, we partner with another program here at the WVU Center for Excellence in Disabilities to offer Triple P seminars on a regular basis. And so at those, I am part of the just staff on hand to help address questions that are maybe more behavior specific. I also give plugs for our various positive behavior support services, including the possibility of doing individual consultation Triple P. And so you can definitely pass this link along to people. That I think the next series of that would probably be sometime early in the new year. And there are three about hour and change seminars that go over the kind of the groups of topics that I talked about earlier. But yes, I think that's it for my content on that. And I know we're close to time already. Thank you for those of you who have hung on and those of you who have tended as long as you can. And so I guess with that, I'll answer any questions people might have. And again, thank you for your time. And if you, at your leisure, we have a QR code for you to complete. Really value your feedback on this session. It's the first time for me taking this deep of a dive into Triple P with people. So I would definitely find your feedback very helpful in refining it.
All right, everyone, if you have time to go ahead and scan the QR code, I'm also going to have Nick email it to me so I can send it with the follow-up email as well in case you don't have access to be able to open that up now. I'll give everyone a couple minutes. And while you're doing that, I'm going to go ahead and go over our next session is going to be December 3rd. And we're going to have TBI in adults, and that'll be by Dr. Nathan Ernest.